Hello friends, welcome back joining me on Lybrate once again, and today I am going to discuss about a very important topic for which I have received so many queries that I decided that I am going to make a video on this topic. And this very important and significant topic that is afflicting a lot of people in our society today is thyroid and pregnancy. Well, a lot of women, they are suffering from thyroid in any form, whether hypothyroidism or hyperthyroidism. And a lot of these women are already in the childbearing age. So it is not surprising that these women, they develop conception during the time that they have got hypothyroidism or hyperthyroidism, or for that matter of fact, they are discovered to be a patient of hypo or hyperthyroidism during the time that their gynecologist for the first time asks them to get thyroid checked. Well, thyroid is a very important endocrine organ in our body which regulates a lot of functions of our body, and at the same point of time the thyroid hormones are very important hormone for the development of the child, and the most important phase for that period, for that development, is the first trimester of pregnancy, which is the first 12 weeks that the women are pregnant, because this is the period of time, the first trimester, when the maximum organ formation develops. In fact, the entire organ development of the child, it develops in the first trimester of pregnancy. And it is only natural that we have to understand that if thyroid is not controlled during that period, then the child may develop many congenital malformations, maybe having a lot of mental disturbances when the child is born. So it is very important for you to understand that if you want your child to be healthy, mentally as well as physically, you have to keep the thyroid under control. I also would like to mention a very important fact here, that the levels at which the TSH is monitored during the pregnancy are different from the levels during which it is monitored during the non-pregnant state. In fact, a very strict control of thyroid is necessary during the time of pregnancy. And if that is not maintained, then not only congenital malformation, but there could be also imminent fetal loss, which can happen at any of the trimesters of pregnancy. In fact, a conception itself becomes a problem when thyroid is not under control. And today we are into an era that a lot of females, they are developing this problem, are facing this problem, that they are not being able to conceive in time, and are very disturbed and agitated, and their families are really frustrated because they are not able to conceive. Well, for that matter of fact, you need to check your thyroid and keep it under control. Friends, thyroid can be controlled only by one pill in a day and needs to be monitored initially only initially on 21-day basis. So every 3 weeks you need to get your thyroid levels checked, and if they are not under control, there has to be a fluctuation of the thyroid hormones in the body, and that is why we have to upgrade your medicine or downgrade the dose of your medicine, and that's the only thing that we doctors do to keep your thyroid under control. Because essentially what we are doing with your thyroid is that we are providing supplementation of the deficient hormone in the body, or we are making the thyroid get itself under control by giving it a pill by which it doesn't hyperfunction in cases of hyperthyroidism. So only by one medicine a day therapy you can do wonders with your body, and you can save the life of your unborn child and give them a healthy and very nice physical fitness when they are born. So please keep your thyroid levels under control, and remember that thyroid is not a frivolous thing, especially during the time of pregnancy. I hope this video enlightens you, and you can get back to me on Lybrate through a very important channel of online consults which has been offered by Lybrate. You don't have to be physically present with me, and you can take my advice simply by logging into Lybrate and finding out the name of Dr. Hanish Gupta. Thank you very much, and thanks for listening.